Hi, it's Dr. Ann Zink, Chief Medical Officer for the state of Alaska. Today is October 30th, and a brief update on where we're at with COVID in the state. On this first slide, you can see Alaska compared to other states, and unfortunately, we're about third in the country when you look at the number of new cases per capita. We're clearly on an acceleration curve, and on this slide, you can see how we've been growing quickly with a 56% increase over the last week. Today, we have 380 new Alaska residents diagnosed with COVID, 4 new non-residents, 5 new hospitalizations, and unfortunately, we have 4 additional deaths. 3 are recent. We're thinking about their friends and family in this time of challenge. On the next slide, you can see the hospital capacity, and unfortunately, hospital capacity in Alaska is always tight and has been getting tighter. You can see the ICU beds both in the state as well as in Anchorage. These are not all COVID patients, and right now, 7.72% of all inpatients are COVID related, but we all need to do our part to be able to make sure that we've got the hospital capacity there when we need it. So we all need Alaskans' help right now. First of all, masks work. They reduce the rate of infection between 50 to 70%, even with some good quality face masks that are cloth, and some can be on par with surgical masks. When we look at air travel with masking, we have not seen any significant infection transmission documented despite multiple flights with multiple infected passengers. In household surveys, masks before a case develops reduce the infection rates by 79%. And in high-risk exposures, universal masking in a hair salon with 2 ill stylists and 138 clients resulted in no infections reported. And in a retrospective case-controlled study, when we looked at exposed contacts, having always worn a mask before, during, and after high-risk exposure reduced the rate of infection by 70%. But masks are not working alone. They also need to be used in combination with other things. Kind of think of it like bundling up for the winter. You wouldn't just wear your hat or your jacket, but doing many things together works better. So we need people to make sure they're washing their hands, staying with your home contacts, staying home if you're ill, and getting tested immediately if you're not feeling well. We need all Alaskans to step into the space to really push these numbers down. Moving on to the next slide, you can see the hospitalizations death. We put a report out recently that looked at what we've been seeing in Alaska. We put out 2 epidemiological bulletins that talk about the number of hospitalizations and deaths by race, ethnicity, as well as location. Overall, we have 39.4 cases per 100,000 in the state of Alaska with a continued acceleration. We've seen a significant increase in the percent positivity with 8.1% of all tests that are testing positive right now. We continue to expand testing, but as more people are getting ill, we're having a harder time keeping up with the turnaround times and adequate testing availability. So again, if you're not feeling well, please stay home, get tested early, but try to minimize your exposure to everyone else. This is a breakdown on some of the regions. So Fairbanks has about 32 cases per 100,000 with a percent positivity of 6.7%. You can see they were up to about 12% and have brought that down nicely recently. Anchorage continues to climb and climbing more rapidly here recently with 46 cases per 100,000 and a percent positivity of 8.98%. The areas that we're seeing fast acceleration include the Mat-Su region with 37 cases per 100,000 and a percent positivity, which is the highest in the state right now, at 17.64%. Juneau has had a slight increase overall, and we've seen a 6.63% positivity with 26.313 cases overall. Kenai is also on a fast growth curve with 34 cases per 100,000 and 12.95% positivity. And the YK Delta has our most cases per capita at over 100 cases, 107 cases per 100,000. And their percent positivity is ranging between 8%. And unfortunately, the Kusulaf region is ranging at 21.82%. We do think that there's some backlog tests in there that will hopefully bring that down, but we continue to follow those. And there's much more detailed information on our website regarding your specific area. Looking at age groups, we see all age groups accelerating right now, but we continue to see the 20 to 39-year-old age group as the group that's having the most cases in the state. We continue to build up our resources, including testing supplies, Abbott Now kits that are being deployed across the state, machines, as well as trying to improve turnaround time because we know that people need that test back quickly. Continue to push out PPE, including 3.5 million pairs of gloves to hospitals, clinics, and additional PPE that's needed. And we continue to try to work on building up our infrastructure, including hopefully a new commercial lab that will open in Alaska soon, as well as preparing alternative care sites to be on standby if needed. We also really need to make sure that we continue to improve the IT systems so we can move efficiently. So while all this is going on, it's also time to vote. Know that we've been working hard with the voting team to make sure that you're able to vote even if you're not feeling well. So if you're not able to vote in person, please make sure that you take a look at the elections website where a person may be able to get you an absentee ballot to make sure you can vote. So, Alaskans, this is our time to act. This is not the time to trick or treat. This is not the time for parties. This is not the time for gatherings. We need everyone to pull back their social contacts, wear a mask at all times when you're not around someone in your immediate household, wash your hands regularly. We have a very limited healthcare capacity and we are seeing a significant surge in cases. We need everyone in Alaska to do their part. So be well, be kind, stay safe. Alaskans are strong and we'll get through this together. Thank you.